I'm here to talk to you today about thumb CMC arthroplasty surgery. You've been advised by your doctor to consider having surgery for the treatment for the thumb CMC arthritis that you have. Thumb CMC arthritis can be fairly functionally disabling or painful. It basically causes difficulty when we grip or pinch because you have pain right at the base of the thumb where you have arthritis. What we do surgically to address that is essentially a surgery where you remove one of the bones of the thumb and you use a tendon to reconstruct the ligaments around the thumb. I'm going to talk to you about the preoperative preparation, what you can expect from surgery, and what you can expect postoperatively, including therapy and recovery. So when you're considering thumb CMC arthroplasty, as we call it, the things to consider is that it's a fairly long recovery. The surgery itself takes about an hour and a half to 2 hours, so it's not a small surgery. The surgery then is associated with a recovery that includes therapy, sometimes includes casting or splinting for an extended period of time. So as you think about this, you want to think about the time that you're going to need to give yourself to recover after this surgery. If you decide to go ahead with surgery, the preoperative preparation is that this is generally an outpatient surgery. You'll often be given, depending on your physician, wipes or a scrub to wash your hand with the night before surgery. You would then present to the outpatient surgery center where an anesthesiologist will review you and interview you to discuss possible ways of doing anesthesia for this type of surgery. As this is a fairly large surgery, we can't do this under just local. So the options for doing surgery and doing the anesthesia are to put you to sleep completely with a general anesthetic, or to put your arm to sleep with a block at the shoulder, where that makes the whole arm numb for about 12 to 24 hours, depending on the length of the anesthetic used by the anesthesiologist. What they do is they basically sedate you lightly and then use ultrasound to guide their placement of local anesthesia around the nerves coming from the neck into the shoulder so that that makes the entire arm numb. What that means after you finish surgery is that the arm will still be numb, giving you good pain relief. You also won't be able to use it all that well. It will be somewhat floppy because the motor use of the arm is also knocked out by that kind of block. That block is excellent for postoperative pain relief, and we usually recommend it. The only thing to remind patients of is that when you get home after a surgery, you want to elevate your arm. When you want to elevate your arm, when it's a floppy, dead arm that you can't feel, you have to take it out of the sling that you're given and often elevate it on some pillows next to you. I'll come back to that after we talk about postoperative expectations. So you'd present to the outpatient surgery center, you'd be interviewed by anesthesia and make a decision as to the anesthesia you choose to have, and then you would go into the operating room where the surgery itself is performed. And what happens during the surgery is you make a small incision generally at the base of the thumb, and then perhaps a separate incision if a tendon is being used to substitute for the ligament. When you make that incision at the base of the thumb, the focus of the physician is that you're going to take out a bone of the thumb, specifically this bone, the trapezium bone. It basically is, this is where the arthritis is at this joint, and basically by removing that, we remove the area that's causing pain. So that incision is made, that bone is removed. Either half or all of a tendon is used to reconstruct a ligament. This tendon at your wrist is a tendon that we can get rid of. It's an extra tendon essentially. So it is not a tendon that gives you lots of function, so you're not going to miss it. After that's completed, the skin is closed, generally with sutures that can absorb, and then usually a postoperative splint to rest the joint and rest the hand is applied. That splint usually holds the thumb in a certain position, leaves the fingers free, leaves the thumb tip free, and it is okay postoperatively once you have your feeling back to move all of these things. We want you to move your fingers and move your thumb tip. When that's completed, you go to the recovery room. You usually would be in a sling if you had that block because you can't control that arm, so you need a sling to hold the arm still. And then you're just discharged home from the recovery room to go recover. In terms of your home recovery, what should you expect? That block, first of all, in the short term, usually lasts, as I said, 12 to 24 hours. What happens and what we talk to patients about in terms of pain medication, because you can't feel anything generally, is that before you go to sleep that night, you should take maybe a pain pill in case that block wears off in the middle of the night. It's hard to catch up with your pain relief if you haven't taken a pain pill. I do consider this a fairly painful surgery, and so tend to give patients narcotic pain medicine to be used in the short term, usually the first 3 to 5 days after surgery. So when you wake up and that block has worn off, you will often need that pain medication in combination with Motrin or Tylenol. Generally, both can be taken as long as you're not taking a Tylenol-containing pain medicine. You want to elevate that hand fairly strictly for the first 2 to 3 days because it's sore, and elevation will help. We often provide the patient with a special ice pack, and you should use that as well. The splint remains on, generally for 1 to 2 weeks after surgery, and then depending on your physician, you may go into a cast. In my own practice, we place patients into a cast for a month, so you have a total of 6 weeks of immobilization after surgery to allow this area to heal, to allow scar to form, to allow that joint to stabilize since we've removed that bone and replaced it with ligament reconstruction. At 4 to 6 weeks after surgery, patients come out of their cast or splint and then go into a therapy splint and begin therapy to start mobilizing the thumb and start working slowly towards strengthening the hand. Generally, it takes 10 to 12 weeks to really recover in terms of being finished with therapy after this type of surgery. But I generally tell patients it takes 6 months or even longer to really feel that they have all of their thumb function back. When we talk about what you should expect after surgery, generally we want you to expect pain relief. You may feel like you've lost a little bit of grip and a little bit of pinch. That's what's been shown in studies, but this is a non-significant amount of loss of pinch or grip. So you should be able to use your thumb fairly normally. We never say good as new or generally back to normal because I think you're having surgery and surgery changes how you use things. But it should give you good function and good ability to use your thumb in a way that doesn't hurt you the way it hurt before surgery. This is hopefully a good introduction to what you should expect from this type of surgery. Good luck.